Thank you for listening to Depictions Media Radio. All right, everybody. You know, for months now, we've been talking about COVID-19 and the health risks that it poses, and how we have to self-isolate in order to keep out of harm's way of a virus. We've also been talking about climate change and the effects that it is going to have by raising temperatures globally that may cause forest fires, heat waves, melting of polar caps, raising of sea level. And one of the things that it kind of goes between the two of them is e-waste, electronic waste. The old cell phone that you just decided just to throw in the garbage because, hey, it doesn't match the network anymore. We need to learn to recycle these things. It is going to and has begun to cause a health risk that is now being recognized by the World Health Association, the WHO. And and Dr. Tedros has actually released a statement about the pollution that it is actually releasing because of the plastics, the metals, and everything that are causing waste around the world, and the health problems they could be posing towards our children. So, before we go any further with this, let's listen to what the WHO and Dr. Tedros actually have to say about this problem and what we might be able to do to curb it and to help clean up our planet from plastics and heavy metal waste, not only from our electronics, but unneeded containers and wrappers that we may actually be using for food and other products that we actually buy. So let's listen to what the WHO actually has to say.
Good evening, good morning, and hello to all of you. I'm pleased that you're joining us for this very important press conference on one of our most precious resources, our children and the health of those children. We are doing this virtually, as you know, and we will first of all have our two speakers, Dr. Maria Neira, the director of our Department of Environment, Climate Change and Health, and Ms. Marie-Noëlle Brunidrice of the Children's Environmental Health, Chemical Safety and Health Unit, the Department of Environment, Climate Change and Health, and the WHO lead author on the very important report we're putting out today on e-waste and how it's harming children's health. Dr. Neira will give an introduction and overview of the subject, followed by Dr. Dries, who will give more detail on the findings of the report. And after that, I'll open it up to questions. To ask your questions, please use the raise your hand function. I'm sure you're all very familiar with that now. And I'll call you in order that the hands appear on my screen. So it's good to get your hand raised early. We have less than an hour, so without further ado, I will hand over to Dr. Maria Neira. Dr. Neira, you have the floor.
Thank you. Thank you very much, Margaret, and thank you all for joining us today. This is an important report. I'm sure that all the reports from WHO are very important, but this is probably very exceptional on the nature of the report, because I think it's the first time we are giving and alerting about these terrible figures and how this electronic waste is affecting particularly our children. What we call electrical or electronic waste, or to simplify the e-waste, is a surprise even for us. It was a surprise to see that it's the fastest growing domestic waste in the world. I mean, among the waste we produce, this is the one that is growing the faster, which is already bad news. And according with the figures that we obtained from the Global E-Waste Statistics Partnership, in 2019, the world has produced almost 54 million tons of electronic waste. To give you an idea, this could be compared with, imagine 350 cruise ships, all full of electronic waste. This is the amount of electronic waste we are producing as a society every year. The problem with that is that not all of those residues, this waste, is properly recycled or treated. Only, this is a terrible figure, only around 18% of those millions of tons are properly collected and recycled. Why this is a problem is because part of a big amount of this electronic waste is exported from the high-income countries where we can ensure this recycling or the treatment, and we send it to the low and middle-income countries, sometimes illegally, most of the times illegally, and sometimes with something which is very, I mean, from an ethical point of view, is horrible, which is under the guise of charitable donation. So we say, let's donate this old computer that we don't need to a developing country. And unfortunately, those computers will never work there, but you clean up your electronic waste. The reason that they are so valuable is because this e-waste still contain certain material like gold or platinum or copper that if you recycle properly, it represents some a way of a source of income for many very poor communities. Unfortunately, to recycle that and to obtain those valuable metals, they need to spend many, many hours, and they are exposed to these chemicals which are very toxic for them. The problem is that the electronic waste doesn't contain only gold or platinum or copper. It contains as well more than 1,000 toxic chemicals that are contained in e-waste. So it's a question of you choose your poison and which one you will be exposed to. And in addition to that, if the electronic waste is recycled on a very inappropriate way, those toxic chemicals will affect and certainly will have a negative effect on the health of the workers, their families, and their communities. And of course, this will include and affect particularly women and children, who are the ones that spend more hours trying to gain some money from recycling those materials. To give you an example, if you look at the highest ever recorded in history levels of dioxins, which is, as you know, carcinogenic in eggs, were found in chicken eggs from a famous e-waste town in, I think it was in Ghana. And consuming only one egg, it will be massively exceed the recommended daily intake levels of dioxins, so even by 220 times. Recycling e-waste on inappropriate of substandard conditions is contributing as well to the burden of climate change, because according to our colleagues, again, at the Global E-Waste Statistics Partnership, we estimate that the e-waste that was collected and appropriately recycled in 2019 saved at least 15 million tons of carbon dioxide from being released to the environment. So here we are another problem that the non-recycling of the e-waste is contributing to the CO2 emissions and therefore contributing to the climate change problem. Children and digital dump sites is the first comprehensive World Health Organization report which investigates the links between e-waste and recycling activities and the adverse health outcomes, particularly in children. And that's why we are so excited about this publication. And we would like to thank the UN University, the ILO, and the E-Waste Coalition for the support they have provided us for the publication of this report. On the report, we try to look not only at the problem, but as well at the solutions and actions, the urgent actions that the health sector and other sectors needs to take to confront this new and insidious, very insidious health risk globally, nationally, and locally. And Children and Digital Dump Site is our way to wake up everyone about this problem, these new public health challenges, considering the effects of the electronics and electronic waste, and have some response by society, and making sure that we will not be too late on that. Let me now move it to Marie-Noëlle Brun-Dries for giving you the most important findings of the report.
Thank you very much, Maria. And I think again, this is a major report for us, because I think for so long we have not recognized e-waste. We've seen it as waste. We've seen it as something that may be harming the environment. But today we're really putting forward the health implications of this badly recycled or wrongly recycled electronic waste. And it's not just an environmental problem, it's a health problem, it's a child health problem. So one of the key data that we put forward in this report is, for example, that according to ILO, in 2016, we had an estimated 18 million children that were working in the industrial sector, which includes waste processing. So this is certainly child labor. It prevents them from attending school. It is bad for the physical health and mental well-being. It's in many cases hazardous child labor, because they're really exposed to a whole series of toxicants that they shouldn't be exposed to, and at ages that probably they shouldn't be exposed to. We have seen in the different reports that children, sometimes as young as 5 years old, have been reported to work at e-waste recycling sites. And this is often because they're helping their parents for the family income. I mean, sometimes e-waste recycling is the only income that the family has, and so it becomes a family business. So children are helping with it, but also children are particularly useful because they have tiny hands. And so when you need to retrieve different materials and different parts of the electronics to tear them apart, it's very useful to have them help the parents. Another one of the key data that we put forward is that globally we know that as many as 12.9 million women work in the informal waste sector, and many of these, and an unknown number of these, are of childbearing age. And this puts them not only at harm themselves, but it also puts at harm their unborn children, because they are being exposed to a whole series of chemicals, heavy metals, toxicants that cross the placenta. We know the placenta is not a barrier anymore. And all of these are reaching the children as their different organs and bodies are being developed, especially the brain. And so some of these effects could not only be affecting this generation, the women, their children, but even be carried into the next generation. Many of these chemicals and toxicants remain in our tissues, remain in our bones. And so we have a legacy pollution inside ourselves that we can transmit to future generations. So there's, as Maria mentioned, there are many very valuable materials inside electronic waste, and there's also a whole lot of toxicants. And one of the reasons why they get out into the environment and they reach the children is because of the way we informally recycle them. When they're informally recycling, we have open burning of wires. People throw a lot of wires into a big fire. We have heating, we have acid baths, we have tearing apart, causing injuries, but we really have a lot of methods of recycling that are really detrimental for the environment and for the health. So these activities, they contaminate the air, the dust, the soil, the water, the food that we eat, and that these communities are exposed to. Sometimes people who are not doing the waste recycling themselves are exposed to it because all of these toxicants are in the air, they're in the dust, and they remain in these communities. We've also seen, some cases of e-waste recycling happening next to schools, for example. And so we not only have heavy metals like lead and mercury, but we also have a lot of toxic products and byproducts because of the way of the processing. So we can be exposed to dioxins, polychlorinated biphenyls, and many of these are persistent organic pollutants or persistent pollutants. So they remain there. They go to the fat of the animals, of the dairy, and then we re-expose ourselves all over again. So in our report, we have found that e-waste exposure in relation to child health is linked to a whole variety of health outcomes. The most important one probably is being the impaired neurological and behavioral development. So it is stunting our children's brains and the health of the brain. A brain develops until we're 20 years of old, but especially when we're young, it is very sensitive to the external risk factors. So this is really bad because these children would never be able to have the full potential that they could have in life because of these exposures. We also link it to negative birth outcomes, to impaired thyroid function, to changes in the cardiovascular system function, to DNA damage, to impacts in the immune system, which makes you more prone to developing infectious diseases, and to increases of risks of chronic disease later on in life, mostly cancer and cardiovascular disease. So this means that the effects may not be visible immediately, but they will be visible later on in life. So across the world, I think we have mostly two kind of scenarios that we put forward in the book. We have some hotspots and some famous towns or famous places where e-waste is being recycled. We have, for example, in our book, Gloshi in Ghana, probably one of the most famous towns of e-waste recyclers in the world. I think it has about 80,000 people in it, and they all live around the e-waste recycling activities. And so this means there is a lot of rudimentary waste scavenging. There's workshops, there's retail workshops, there's refurbishing, reselling of all the used electronics. And we have also a lot of these e-waste exposures that are invisible. For example, as it happens in many Latin American countries, it is recycled as part of the other waste. So, so the waste pickers or the waste scavengers take out this waste because it's more valuable, because it sells better, and then they are recycling it in neighborhoods, and it's mostly hidden, and you can see sometimes these signs across in some neighborhoods that say "I buy metal, anything with metal," or "I buy everything," and often it means that behind it there's a workshop. Many of these workshops are home-based. Sometimes it happens within the family itself, as we said earlier on. And I remember I visited one day a neighborhood in a Latin American country that was a slum, and it was a place where actually there was a lot of criminal activity. There were drugs, there were prostitution, there was a lot of violence going on. And probably the thing that people thought was the activity that people thought was probably the most honest activity was to do e-waste recycling it. And they were doing this in good conscience, and it was their way of income. So we tried to get into the houses to see how these workshops were. And it was difficult for us to get into the houses because people didn't want to open the doors. And so the best way for them to open the doors was when we asked about the child health. Are your children feeling well? Are they doing well at school? And then immediately we could see how this message really resonates with the communities, and we could go in and we could see sometimes tiny gardens where you would only see huge piles of electronic waste. Children had nowhere to play. And if you looked inside the houses, sometimes the houses were very small, and the children's beds were separated by huge piles of batteries, of car batteries, of different kinds of batteries. And these were full of lead, of course, one of the major neurotoxicants. And this is the way they were living, and this is the way they were providing a life for the families. So another thing that you can sometimes see also is and this is part of this, the visible signs of this invisibility is in some places, for example, you see enormous stains, black stains in the ground, and it means that someone has been burning cables. To retrieve the copper, around the copper in the cable, you often have lead, and then you have plastic. So they burn the cables, it releases a lot of cancerogens into the air, and then the lead remains in the soil, and of course it's dispersed, and it's contaminated whole environment. So in this report, what do we call for? So what we call for is a more effective and binding action by governments, exporters, importers, so that we can have an environmental sound disposal of e-waste. So some of the key actions that we put forward include ratifying, enforcing, and implementing existing conventions, chemical conventions, Stockholm Convention, the Basel Convention on Transboundary Movement of Waste. To also put health and child health, especially at the center of all these policies, of all the different e-waste policies, to work with other sectors because we don't have the solution on our own, to ensure the health and safety of workers, to train them, to monitor their exposures, to allow them to understand what are the things that can be done, that they can do that would not harm their health, to take away all this recycling away from the community, from the homes, maybe do a workshop in a community, but separated from the children, separated from the schools. A famous scientist said once that probably dump sites are the favorite playgrounds for the children. And when you add electronics in it, I think it's even more appealing. So we also call for enforcing sound environmental health practices for disposing, recapturing, and reusing the materials, shifting towards a more circular economy. I mean, we need to produce more durable, sustainable electronics. We need to use safer, less toxic materials. We need to encourage sustainable consumption, and we really need to work with industry to make sure that whatever we buy that is electronic doesn't have to be replaced every 3 or 4 years. Most importantly, we need to eliminate child labor. And we also need, and I think this is really important, I mean, we have seen how these communities depend on this for a living. So it's really important that we incorporate the communities and the workers as part of the solutions. We give them access to healthcare. Many times these communities don't have access to any healthcare system. And there are some initiatives going on, like, for example, and there are many of them, like the best of two worlds. So trying to define exactly what could be done by these informal workers that wouldn't harm their health, and what has to be done, taken back and taken to a more to a more refined facility where the electronic waste can be recycled. And finally, we really, and this is one of the main messages today, we really need to raise awareness of the health risks of e-waste improper recycling. So this report also calls on the health community. It's mostly addressed to the health community, and we want them to take action. So we want them to build the health sector capacity to be able to better diagnose, to be able to know when there is any waste problem, to better identify it and to report it, and to work with the local communities. To advocate also for better data, especially on interventions, and to raise awareness, especially within policies, of the potential co-benefits of more responsible recycling. We also believe, and I think this is a special public for us, that engaging with adolescents, with young people, is also essential, because they are the present and the future consumers of electronics, and they are unique agents of change and advocacy. And we have seen this in the climate march when they demand actions for climate. And so they must really be aware of the impacts that our electronics can make on their future health and on the environment. And they will certainly be one of our most important allies in creating action. We know that in Europe and United States of America, the average life of a mobile phone is currently 2 years. So a person will use about 30 mobile phones in their lifetime, when probably we could use much less if we were able to, if they were more sustainable. There's also something that I've heard that I think is quite impressive, is that often adolescents and youth who work with electronic waste find this, first, it pays better, but also they find this, that it's kind of working in electronics and not necessarily on waste scavenging. And so they call themselves reverse engineers, which is much more prestigious. So to finish off, I wanted to let you know about the initiative we have in WHO on e-waste and child health. We have an initiative that seeks to generate evidence and build capacities of the health sector to better address e-waste exposure. We are also running pilot projects in African and Latin American countries at the moment. We want to create frameworks for action, pilots that will be able to be taken as an example and adapted elsewhere to protect the children from e-waste exposures. We are also working across sectors, even within the UN family, to have more meaningful and sustainable impacts. And we're working right now with 10 UN agencies and international organizations as part of what we call the e-waste coalition. So it's a new coalition that aims to address the e-waste challenge worldwide by raising awareness, increasing knowledge, and also providing support to countries to prevent, reduce, collect, recycle, put the right policies in place, put health at the center, and dispose of e-waste sustainably. But again, just because we have this need to work with other sectors, all the different UN agencies, we all have sometimes a different piece of the puzzle, but put together, we can become really powerful. So my final message would be that we really must do more to ensure that future mothers, children, adolescents, and their environments, which are essential for them to pursue a healthy and fulfilling life, are protected from the terrible risks that poorly managed and unregulated e-waste and e-waste recycling activities pose. So children, we have to remember e-waste is a resource, but children are our most precious resource, and they are the future of our planet. So we cannot afford to harm them before they are born. So with this, I finish. Thank you.
Thank you so much, Marie-Noëlle, for that really powerful message. That is so, so true. We have 66 participants. We've got a number of hands raised, but unfortunately, I cannot see the names of the outlets of everyone. This is a media This is a press conference for the media. So if you're not from the media, we can't call on you. There will be a Facebook Live later, I understand. So you will have your opportunity then. If you are from the media and you haven't put your outlet, please indicate your outlet, or please rename yourself, or let us know in the chat what outlet you represent. Also, a number of people have asked us for links to the report. Not everybody's had a chance to read it. It's a fantastic piece of work. The link to the report is in the chat, so please make the most of that. Now, the first question, somebody who has indeed put their outlet, goes to Belisa Godinho from W Magazine. Please go ahead, Belisa. Unmute yourself and ask your question.
Thank you. I'm Belisa Godinho from W Magazine in Portugal. My question is, how WHO pretends to combat the e-waste? Do you have global initiatives involving children? Can you mention a few examples?
I think I'll go to Marie-Noëlle for that question first.
Thank you. Thank you very much. Yes, so we have an initiative that has been going on for a few years. What we've been doing up to now is generating a lot of evidence, because again, this was not really seen as a health problem, and we really want to put it forward as a health problem. So we've developed systematic reviews, journal articles, now this publication. But at the same time, we've developed some capacity building tools, mostly for the health sector, primary healthcare workers, community workers who are there in the front line and working with the communities are really important actors of change, and also well respected. So in this report, if you look at the action section, you can see that we have put forward a lot of different things that can be done by asking the right questions, working with the community, relaying the information to the mayor and to the authorities, trying to find ways with the workers in which they can work, they can use better equipment, they can change their clothes when they come home, but giving already very good advice. And also, what are the key monitoring indicators and biomonitoring that could be used to better be able to assess the impact of the policies that we have in place. So we've been focusing a lot on generating the evidence, building the capacity, and we also have international free e-learning with other agencies that look at the whole spectrum of the e-waste problem, including the health one. And so for us, our next steps are really to be able to work with the regions on the different pilots that we can put then forward for other countries to have examples to follow. That is one of our immediate steps. And also, this will also be done as part of the e-waste coalition. And I think soon we are planning a regional special e-waste monitor for Africa to be able to better target the problems there.
Just to add, Margaret, if I may, that this is part of WHO's program on environmental health, where we look at all the chemicals or all the environmental risk factors that will affect the children in general. And this is a very specific one on this public health challenge represented by the electronic waste. Over.
Yes, I'm sorry, just to add to that, and I think because of what Maria said, we have a number of World Health Assembly resolutions that are actually asking us to act on this. And so this is the way that we are taking forward the action to be able to implement these resolutions that have been agreed by the Ministers of Health.
Thank you to both of you. I've got a lot of hands up, but I'm still not seeing the media outlet. So please rename yourselves and put your media outlet so that we can call on you appropriately. We do have one question from somebody who wasn't able to connect, and that is, what can individuals do? So this is a serious problem, but what can individuals do to mitigate the problems you've identified? I think I'll ask you first, Marie-Noëlle.
You want me to start, Marie-Noëlle?
Yes.
Clearly, we need to be aware of the problem. I think that will be the first thing. Know about this, get informed, start to pass this information and share it. And then if you want to contribute to that, I think it's very much related to the issue of the consumption patterns we have. We need to reduce our consumption of electronics in order to generate less waste. And particularly when we know where this waste will go, we need to put pressure on our politicians to make sure that the conventions that have been signed are executed properly. And we need to make sure that our politicians and the governments and policymakers are very much aware that this is representing a major health risk, and therefore something needs to be done. As an individual, be aware of that, reduce your consume, and exert your political pressure as an individual and as citizens that can vote as well.
Yes, and I think that's a very, yes, that's completely, that's a great answer. And on top of that, we always promote the 3 R's. So reduce, reuse, reduce, and recycle. And I would even add a 4th R on repair, because many of the things, we just throw them away without even thinking if we can repair them. So yes, so I would say we as individuals can already contribute with that.
Thank you. And there's a follow-up on that, which is, are there any clear standard operating procedures for safe disposal of waste? Is it clear what people can do, that they can do differently? I mean, we're talking about companies and to avoid children being in this circumstance.
Marie-Noël, over to you.
Yes, so I think the most important thing is that we need to make sure that the countries implement their policies and their conventions. So we don't allow, for example, in developing countries, for waste that comes from abroad to come in if it's not real, if it's real waste, if it's not really a donation, or if it's not functioning equipment. But there's also for example, ILO, the International Labour Organization, has developed a checklist, for example, on what are the best things for occupational health safety for the workers. But I think already for these workers that are working there, first of all, we need to make sure that they have some kind of access to healthcare. But also there are certain steps that can be taken. For example, there are machines that exist that can allow you to strip the wires instead of burning them. There are also take-back systems in some countries in which sometimes the informal workers can take back all this electronic waste and have some kind of financial gain out of that and continue living. We also need to make sure that these places don't happen next to where the children live, that the workers change their clothes when they go back home. And that they also, the places are well ventilated. So there's already quite a few elements, and there's quite already a few being tested in some places. For example, in Ghana, that famous town of Abogloshi has quite a few projects. One, for example, has just installed a healthcare clinic, is training the workers themselves on safest ways to recycle, and is also, they put up a football pitch to make sure that the community still has other ways of cohesion other than the work, etc. So yes, there's a lot of pilots, and this is one of the reasons why we're trying to do our pilots and our frameworks from WHO, is to be able to have much more concise answers. But if you look already at the report, if you look at the action section, you can see already a lot of suggestions and solutions that are put forward.
Is there anything you'd like to add, Dr. Neira?
Well, I wanted to say that, yes, standard operating procedures exist. So the countries need to, and the big companies, producers of all of this material, they need to, and they know the responsibility they have. Unfortunately, those standard operating procedures are not always respected. And one of the most dangerous part of that is when, on a very charitable way, somebody decides that in order to, rid off of all the material you have, you send it to a developing country, and then, end up in a totally informal, illegal, and not operating procedures applied.
Thank you very much. Now we have a question from Vijay Shankar Balakrishnan, who's representing the Lancet for his question. Please go ahead, Vijay.
Thank you very much for the opportunity, Dr. Harris. My question is open to anyone who is willing to answer. Recently, on June 9th, the UN University has reported or published a report on the impact of COVID-19 on e-waste in the first 3 quarters of 2020. And the report concludes as a side information that millions of tons of e-waste has been saved. And it also projects that there will be a reduction of about 5 million metric tons of e-waste in the next 5 to 15 years. So against this backdrop, do you believe that this will perhaps help in improving the health condition of children in countries of Northern Africa, Western Asia, Sub-Saharan Africa, and Central Asia? And if yes, what sort of policy recommendations based on the evidence that you have collected for this report that you would like to propose?
Noel, over to you.
Yes, well, we didn't look in our report. We didn't look at COVID because it had started, recently when we were finishing the main conclusions from the report. One of the conclusions from the report is that the electronic waste recycling, formal recycling, does affect the immune system of children. So it makes them more prone somehow to catching infectious diseases, and that often the communities that work on this don't have healthcare access and often don't have very good sanitation, water, hygiene measures, or any notion of social distancing or even protective equipment. But yes, we are aware of this report, and actually it shows that there was a decrease, but mostly in developing countries. In developed countries, it decreased only very little. During the first 3 quarters of the last year, the amount of electronics produced, not electronic waste so much, but electronics produced. And so we will have to see. This is a transition period. I don't know, maybe because of teleworking, we'll end up using more electronics. But there's also another very interesting angle here is that what we are analyzing today as electronic waste is somehow the electronics and the electrical equipments that have been existing for a few years. We also have a whole new range of electrical and electronic equipments. We have electronics even in our furniture today, in our toys, in our houses all over the place, in our cars. So I think the projection for the future is still a difficult one. But the United Nations University is certainly the biggest data source for everything that is related to development of e-waste and also flows of e-waste throughout the world. So yes, hopefully, but I think these communities probably will need to get formalized to find a new way of income and to have their health protected so that we can actually protect their children.
Thank you very much. Would you like to add anything, Dr. Nera?
No, thank you. Just to say that maybe that we all know that COVID-19 will generate probably more poverty and more difficulty on economic terms. So we need to be very, very worried and very much attentive to the fact that we will not see an increase on this recycling business, so-called, and then we will have more children and vulnerable people exposed. So this is a potential risk due to the bad economic situation that the COVID-19 has created for many societies.
Thank you so much, Dr. Nera. We've really come up to time looking at the clock, and we have no more questions from people who've identified themselves as representing a press outlet. So at this point, I will close this press conference. Any last words from either Dr. Nera or Ms. Teresa?
Well, just to say that thank you very much to all of the journalists and others that have connected to follow this, what I think is a very challenging report, touching all aspects of our society. If you can see, it's about very vulnerable people that need some economy and therefore will go to situations that are absolutely unacceptable. Children playing on a dump site, on a horrible waste mountain. And it touches well of the fact that we need to be more conscious about the way we consume and we produce and we recycle. And we need to be more aware of how environmental risk factors are affecting our health. The children and the future of those children, how their health as an adult will be affected as well. But I hope that with this report, we will contribute to the awareness raising that is very much needed. Thank you all.
Thank you so much. And thank you, everybody, for participating. We will have the audio, we will provide the audio file of this press conference and put it on the website. And please contact us via media inquiries at who.int for any further questions you have. Thank you so much. And thank you for your interest in this critical subject, the health of children. I will now close the press conference. Goodbye.
Thank you all. Bye.
Thank you.
Thank you for listening today, and thank you for supporting us with our sponsors. Please go to depictions.media for more information and click on our contact link and let us know how we can help. How we can help bring your story and help bring us to a better world. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.